Hello, hi everyone. I hope you all had a fantastic weekend and welcome. I'd like to welcome all of you to join this live today. Thank you so much for joining me, and we are going to talk about some fantastic topic today. It's going to be very interesting, and I actually have got a lot of queries about this topic. So this was my recent post, and it was hypospadias, and it is a congenital disorder where we don't have the opening of the male urethra at the tip of the penis. Instead, it is opened on an other side, or the lower side of the penis. And this is a very important topic. Sorry, somebody's asking the topic. The topic today is hypospadias, and that's what we're going to talk about. And I thought it was just absolutely fantastic if we could actually talk to a specialist who takes care of hypospadias, because hypospadias is a problem which can usually only be taken care of by surgeons. So we are going to meet a surgeon who is a pediatric surgeon. He is an assistant professor actually in Madras Medical College, and he also works for Mala Fortis, Chennai. I am waiting for Dr. Karpaga Vinayakam, who is an absolutely fantastic surgeon, and he is also a classmate of mine, to actually join us in today's live. I am waiting for Dr. Karpagam to... Hi Rajiv sir. I'm waiting for him to join us so I can actually invite him. I will also to Dr. Karpaka Vinayakam, and he should be joining us anytime, hopefully. And hello, Sunil Kumar. Hello, hi, Kriti. Hello, good evening, everyone. Thank you so much. Hello, hi, Apurva. I am waiting for Dr. Kalps to join us, guys, and we're going to talk about hypospadias today. And just to touch base, hypospadias is a congenital condition where the opening of the penis, or the urethral opening as we call, is not there at the tip of your penis. Instead, it is elsewhere instead of in the tip. It is a condition which is actually and can be seen and identified really in newborn babies if parents are alert and aware of this condition. And that is why I thought was very difficult to actually, very important to actually talk about this condition, because a lot of the time, if parents are not paying attention or don't know about this and they just, let it go, I think it might be a problem for kids who are growing up, later, which I feel is very important to be addressed today. In today's situation, it's very important. Education is very important. So that's why I'm waiting for this person to actually join me. Dr. Kalps, if you're there, you can send me an invite. Um, I am sending you another request, and if you're there, please. Yay!
Yeah, hi Nidhi.
Hello,
Hi
hello.
Nidhi. Hi.
How are you? How are
How are you?
you?
Yeah, I'm great. I'm doing great. How are you?
Very good, very good. So here, everyone, we have the fantastic Dr. Karpak Vinayakam
Yeah.
that I have been talking about for so long. I have just very quickly introduced you, and I've said that you are an assistant professor in Madras Medical College in pediatric
Okay.
surgery, and you also work in Malar Fortis, Chennai, in pediatric surgery. And today's topic that we'll be talking about is hypospadiasis, which the most important thing that I was saying that we are going to talk this topic
is because it's very important for parents to be aware, to be able to, detect this in their children in a very young age so that they don't grow up with it. We don't brush things off that are happening in our genitals, which I think is very, very important. So let's very quickly jump into the topic, Karbs, if that's all right. And I first want you to just give a small introduction as to what is hypospadiasis. Are you there? I think something is playing up with the internet, guys. Just hang in there.
Hello. Hello.
Yes, are you there? Can you hear? Hello, கேக்குதா?
Anyway.
Yes, I think so.
I'm sorry. I'm extremely sorry for that. I don't know what's happening.
No, it's okay.
So, yeah, anyway.
So,
yeah.
Okay. No, so let's just start off with an introduction to what is hypospadias.
Okay. First of all, I want to. I'm very surprised that you have an audience who wants to know about hypospadias, because hypospadias actually is a very complex congenital congenital aspect in male children. And before going into hypospadias, I just want to brush up the anatomy. Hopefully, you can do that for the audience.
Yes, absolutely. They'd love to learn. We have an audience that love to learn.
Oh, okay, fine. So basically, male genital anatomy, I think everyone has to be aware of, not only male, of both sexes. But for to properly know what is hypospadias, you have to know the male anatomy inch by inch. So first, I'll just go through my laptop. I'll just switch the video. Yeah. So can you see here clearly?
Yes. Perfect. Yes, we can.
Okay. So the male genital organ is known as the penis, which consists the penis and the scrotum. And the scrotum usually has the testis on both sides, which is responsible for production of the sperms. And this is the male genital structure, and the tip of the male genital structure is called as the glans penis, or the hooded part of the penis. The second is you have a collar here. You have a collar just below the glans, that is called as the coronal sulcus, and you have the shaft of the penis, that is the body of the penis, and yeah, as I said, that is the scrotum, and you have a median raphe running from the scrotum till the tip of your penis. Also, this is the inner aspect of the penis. What I am actually talking is the inner aspect of the penis. Now we have to talk about the outer aspect. So now the outer aspect, it is covered by a skin, that is otherwise called as the foreskin or the prepuce. So that covers through the entire structure of the male of the penis, and only if you retract the prepuce, you could identify the urethral meatus there. So again, I have drawn some few diagrams here. So that is what it is basically. So you have this is a prepuce. This is a prepuce. Yep. Once you retract the prepuce down deep below, you could see all the structures where I have described. This is the urethral meatus, which runs along and enters the urinary bladder. So this is the normal anatomy of the male genital organ. So what is hypospadias? Now, hypo is below, and spadias is opening. So now, if you go through this picture where I have drawn here, from the development, usually the urethra, that is where the part we pee, because from the urinary bladder the urethra develops, and that develops at 8 weeks to 20 weeks of gestation. So I don't want to go into much of the developmental and all. Usually, it develops from below, and it forms a tubular structure, and it has to open till the tip. So that is where we pee. If there is an arrest in development and it opens below, that is below the penis, it is called as a hypospadias. That is what I want to say. So
Fantastic.
so you understand? I think people would have understand.
Absolutely. I think this is fantastic. I think the whole anatomy, because people actually really nowadays want to know the real terms and words that we're using, and they really want to know the structure. So I think that is absolutely fantastic, and your drawing is just so very explicit. So I think it's very good. People will definitely get what you're trying to say. That's absolutely fantastic. And I also wanted to ask you, are there different types of hypospadias?
Okay. So again, we'll go through the pictures again. That is very essential. So yeah, if the urethra, that is what I said, the urethra, if it opens below, not only here, from the tip of the glans till the below the scrotum, it is if it opens anywhere from this, it has various types, and those types I will mention here. So anywhere from the below the scrotum till the tip, if it opens downwards, it is called as a hypospadias.
So the
So here,
whole of the urethra can actually open anywhere on the
anywhere
undersurface of the
under
genital. Yes.
genitals, yeah.
Okay. Okay.
So again, I have drawn a few diagram
Oh,
here.
wow.
So,
Okay.
so
Perfect.
okay.
Okay.
So
Yes.
so this is the anus there, we potty that you just forget about it. So this is a normal opening where it has to open, the urethra.
Okay.
It has to
Okay.
open normally at the tip of the glans.
Mm,
It can open somewhere mid-third of the glans or below the glans, at the level of the glans, or at the level of the collar, I said, that is the corona. So you can open there, and it can open below the corona or anywhere in the body of the penis, or at the level of the scrotum or below the
Wow.
scrotum. So
Right.
based on this, if it opens on the glands, it is called as a glandular hypospadias or a glandular hypospadias. If it
Right.
opens at the level of the corona, it is called a coronal hypospadias. And if it opens just below the corona, it is called as a subcoronal hypospadias. So most common types of
Yes.
hypospadia are more in the distal aspect, that is close to the glands.
So if we the hypospadias where you have labeled as 20%
Yeah.
and even below that as 30%. So in that area, if the hypospadias occur, usually you think that people will be able to recognize it much easily and much better than it occurring in the first
Yeah,
part.
yeah, yeah. So if it opens in the tip, people don't recognize the parents, or only a specialist can identify the problem as a hypospadias. If it opens just, distally, that is where below, more below, those are the severe forms of hypospadias where you can easily identify there is something wrong with the genitals of the baby.
So, do you think that people who come to you mostly are the people who have that 20%, where it is below the sulcus, that they come to you? And you feel that most people, if the hypospadias is happening above the sulcus, they just tend to not come to you, or just hope that it will get better sometime for the child or something like that?
I don't say that, because
Okay.
the more people, yeah, I have seen few patients coming at later stages of their life. I would ask them, why you are so late. They said, okay, I thought this is totally normal. They were telling me it was totally normal, because when they come is when the child strains to pass urine, or if it passes a thin stream of urine, they recognize something is wrong. Also, in these cases, in hypospadias, it is not only the hypospadias we are worried. There is something called as cordy. There is something
Ah,
called as cordy. So
what is that?
what is a cordy? So cordy is, most of the hypospadias are associated with this cordy. Cordy is nothing but ventral curvature of
Curve.
the penis. Okay,
Okay.
so they do find that the child is not able to pass the urine in a straight stream, and the child passes urine in the legs, or it finds difficult to pass urine and squats and pass. So that is where they
Ah,
come. That is where they come. So inability to direct the urinary stream in the
into the toilet.
into the
Oh,
urinal.
wow.
So
That is something
there
that parents should actually, keep an eye out to.
yeah.
Fantastic. What age do you think, you know how the toilet training and the kids, doing that and stuff like that happens only later, right? Like around, let's say, 3-year-old kids or something like that. What is the age group do you think you see parents bringing their children to you?
Nowadays, I mean, in India, I think Tamil Nadu has I work for a government organization, and Tamil Nadu has a good health organization. They have a lot of PHCs, a lot of district hospitals and tertiary care centers. And so they tend to pick these anomalies early. I have been seeing children after newborn. Only few are missed. Considering psychosocial impact.
Yes.
So they don't come.
Yes.
Most of them are being referred from PHCs and district level hospitals to our center.
Which is very good. I think that is what we are trying to talk today, isn't it? Those psychosocial things that actually prolongate people from coming for these issues.
Yeah.
I think that is the main thing about this. And if they come to you, is surgery the only way to go for hypospadias?
Okay. So basically, what I want to say is, I'll just show another picture. Okay.
Yes, sure.
Okay. So this is Cardi. Okay.
Wow.
This is called as the Cardi. And in a hypospadia, if a hypospadias child present to us, it presents like this. So you have the urethral opening is somewhere here. There is no urethral opening. There is fibrous bands running around here. This produces the Cardi. And they don't have the ventral aspect of the prepuce, that is the foreskin, and they have only the upper aspect of the prepuce, which is like a dorsal hood. So they come like this. So as you were asking, like, do you need to do a surgery? Yes, obviously, as a pediatric surgeons and a pediatric urologist, we are considered as pediatric urologists because we see most of the cases of 50% of pediatric urology. And we are also cosmetic surgeons in this aspect. So in order to, if the child grows, this is not corrected. If this problem is not corrected, then they tend to have psychosocial issues. They tend to doubt that. They tend to doubt their sexuality. They want to pee down, and so there are lots of issues here.
Absolutely.
So I see milder forms of hypospadias where it opens at the tip or the glans. They are okay with it. They don't have much curvature, and they tend to say they don't come to the hospital or they don't want surgery. But eventually, we need to produce. As a surgeons, we need to give a good cosmesis, and at some point of time, they might require surgery. And surgery is the only option. There is no other way. Surgery is the only option.
Perfect. It's very good to know. And I think it's very important that we talk about these things, because people keep postponing it, hoping it's going to become okay, or, just ignoring it, which I think they shouldn't. So I think that's why we're bringing this up. And would you also say that it is better sooner treated than later?
Okay. So surgery in hypospadias has come a long way, over 100 years. So before surgery was amputation of the penis just above the opening. So imagine that. But now, now surgery has come a long way, but still it has to go a long way. Hypospadias repair for minor issues like in the tip and all. Those cases, the complication rates are lower.
Good.
Whereas in more severe forms, the complications rates are higher.
Right.
But
they should still go, though the complications rate are higher, it is better for someone with, very severe hypospadias to actually go through surgery, even in terms of their self-esteem, their sexuality, their mental health. Is that what you're saying? Is that right?
Yeah, yeah. But they have to, I mean, what you said was they postpone the surgery? No,
Yes.
because
Yes.
um, hypospadias surgery in Western literature, it is different. Whereas in India, we start by 1.5 years of age.
Mm-hmm.
I'm talking in India, but
Mm-hmm.
actually in Western literature, it is the recommendation is from 6 months to 12
6
months,
months to 12. Yeah.
6 months to 1 year of age. But in India, we start late. In India, we start late. We allow the penis to grow some tissues around so that we can do a good repair. And if the surgery is postponed, if the surgery is postponed, there is much scarring of the tissues after surgery. There is much scarring of tissues after surgery, and later on life, once the child reaches adolescence or adulthood, there is increase in there is erection of the penis.
Yes.
After surgery, that erection should not be there. In children, those erections are not there much, so that there is less amount of wound breakdown. Surgery going haywire is less in
In children.
in children.
That's a very good point. That's a very good point to note, I think. I think it's very important for people to know this point, because it helps in healing and everything, isn't it?
Everything.
Like, yes,
Yeah.
yes. Oh, wow. Yes, it is. It's true. And people have also sent me some questions asking, uh, fistula after hypospedia surgery is very common. So do you still think people should get surgery for hypospadias?
Okay, as I mentioned, okay, what about the person who's having a hypospadias? How is his mental issue? We don't have any data on that. I don't have
That's
any
right.
data on that. I operate on kids. The long-term follow-up, I am not having any long-term follow-up. Even fistula is there. Fistula is one part of the complication. There are more complications. There are many other complications. Fistula is just a one part of a complication. And fistula, if it occurs, okay, I'll just draw one diagram and I'll just show what is a fistula. So again, here, sorry. So see, this is where you bought the urethral meatus after surgery.
My God, you're so fast in drawing.
Yeah. Suppose a fistula is nothing but a small opening where on the path of the operative repair. Okay.
Yeah,
So
yeah.
once a patient, fistulas don't develop very lately. They can occur early, but it can also occur late, but not very late. Even if it occurs, there is a normal urethral stream. This fistula, there will also be dribbling of urine coming out through this fistula, since it is a tube what we have created. So from this can heal because there is a forceful urinary stream outside. This can heal by itself. Only large fistulas tend to go for resurgery. So I think if you weigh the complication, I think definitely a hypospadias person should undergo a surgery because what if if he's getting married?
Yes, that's my next question. I'm coming there.
Okay, what is if he getting married?
Yes.
In What if the partner says, "What is this ugliest part on your genitals?" So
Yes.
definitely, yeah, I think they should go undergo surgery.
Yes, I agree. And I think people are extremely concerned, again, coming to the marriage and, things like that. I think people are very worried about other people judging them. Like you exactly said now,
Yeah,
other people judging them for how their penis looks or how it looks a little bit different. I think both the person and the partner having sex are aware these days. And it is extremely anxious, and extremely anxiety causing for
stressful.
those who have
Yeah, yeah,
hypospadias.
yeah,
And you're right. And they go to withdrawal. They start having relationship issues. They withdraw themselves from becoming intimate
yeah,
because of the worry of how it looks. So I think they have a lot of mental health,
yeah,
that has to be addressed in an adult when they have
yeah.
hypospadias. And I think that is very, very important that you brought it up. And people are also concerned that, what is does hypospadias actually make someone infertile? Is it a problem for them to have babies if they have hypospadias and if they have not been if they haven't had surgery or if it hasn't been corrected?
Okay, so hypospadias per se can be associated with other conditions also, say like
Mm-hmm.
undescended testis, where the
Mm-hmm.
testis is not descended into the scrotum in a male child. I'm
Mm-hmm.
not going deep into that. We can talk about it some other day. But
Yes.
in a hypospadias, I don't have, I mean, I have never done studies. But
Mm-hmm.
what I'm going to say is what I read from the Western literature or the studies which people have conducted. Yeah, definitely. Hypospadias in a very mild form, mild form. So before that, they should know how much is the sperm count. So normal sperm count is 40 million to 330 million per milliliter of sperm. Okay. So again, hypospadias men can be, they cannot, I mean, I will not say infertile, they can have a lower sperm count. Say like for a milder forms of hypospadias, they can have a sperm count less than 50 million. Or
Why is that? Why is the urethral opening connected with the sperm count?
So no, I mean, those they didn't have answers. That is what I can say. Those they didn't have answers. Now I just want to say, if hypospadias is associated with undescended testes, definitely there are studies showing that sperm count is less than 10 million or so.
That's very good. It's very good to know because one of our viewers have asked if someone doesn't want to repair their hypospadias or fistulas, then can it give them problem in their sex life? And I think the answer is yes. Is that
Definitely
correct?
yes. Definitely
Yes.
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 Definitely yes.
Yes.
So a male penis is we need a male penis that is both which is functional and which is cosmetic. Okay,
Yes, that's
so
correct.
functional
Yes.
issues is you need to pee from the tip. The second functional issue is to have a good sexual life.
Yes.
In hypospadia, there is always associated cardi. Okay, once they enter into wedlock or they have a sexual relationship, what happens is during erection the cardi is so severe they tend to find a difficulty in penetration in the vagina. One, if the orifice, that a hypospadic orifice is still down, too down, the sperm, they have orgasms, they ejaculate, but the sperm is not deposited in the proper place. So definitely yes, you need.
There is a problem. Yes.
There is a problem, and again I
Yes.
said cosmesis. With that, definitely they are stressed out.
Yes.
They are definitely
Mental
stressed out.
health.
Mental
Yes.
health is
Yes.
affected. So
Yes.
definitely you need to do a surgery for these patients.
Absolutely. I agree with you, and I cannot emphasize enough. As much as we want to say, embrace as you are, embrace your body, and yes, it is all very true. But both functionally and cosmetically, like as you've mentioned, a male genital is very important for one's mental health,
Yeah.
one's self-esteem, one's relationships, everything. And I think it
Everything.
plays such a major role. And if something like this could be recognized in a very younger age, and if there are fantastic surgeons and surgical options available these days, which is going to probably help you in your mental health, in your relationships as a grown-up adult, I would definitely agree with Dr. Karup and say that is a fantastic way to go ahead for it. And I know that people are having a lot of questions about,
Please,
recurrent
please.
strictures. What
Okay.
recurrent strictures in surgery? What about that?
So, I mean, I don't have data on adult hypospadias repair, which is totally done by those missed in pediatric population are done by our urologists, adult urologists. In fact, adult urologists on their training days, they come to a pediatric surgeons to learn about hypospadias because we do a lot of surgeries. Regarding strictures, I would say I mean, there are few complications. I mean, just 5 complications in hypospadias repair. One is, as someone mentioned, it is fistula. Stricture is where the urinary stream is trying to rush through the urethra so that you have a good urinary stream. If there is a stricture, there is thin urinary stream, or the patient or the hypospadias person tends to strain during maturation. And strictures in pediatric surgery, we have come across very few. I have never seen a lot of strictures. So I cannot comment about adult patients. I'm sorry, I couldn't comment about adult patients on that.
No, that's all right. That's good. Sorry, there's also someone who wants to know, as an adult, if I want to go and get surgery done now, when can I commence to have sex in normal life? Like when can they, I think they want to know recovery time. If they're going to get married now, can they go and get surgery, and then how quickly can they? Yeah.
So, that's what. See, hypospadias surgery, if it is done at an earlier age, the complications rates are less than 10%, depending upon the severity. If they are gonna get operated in adolescent or adult stage, the complication increases from say 40 to 50%, which is quite high. So definitely, you might get fistulas, or as you said, strictures, some meatal stenosis. Even though if it is at the tip, there might be stenosis of the meatus. So there are basically few things. So you don't know whether this surgery would be 100% success, or whether you're gonna go for surgery again. You don't know that. So if it is a successful surgery, and I would suggest that you wait till 6 months before going for
Okay, so it's not
hepl.
something that people can do as a rush. Like, if the marriage is fixed in a month, it is not really advised for you to go and fix it now and hope that you don't have to talk about it or get it fixed. Like Dr. Vinayakamp is saying, I think it is very, very important that you take enough time, give it enough time to heal, make sure, you anticipate for any surgery or any procedures, guys. I think it's important that we anticipate some complications. And I think that is why doctors always explain or go through complications with you, because yes, we are hoping that it doesn't happen to most of our patients, but we have to be open to the fact that it could happen, and we need enough time for it to heal, for us to deal with it.
Because hypospadias surgery, I mean, after surgery, the normal time taken for the tissues to heal without scarring is 6 to 8 months. So that is the time you need to give to the patients. That is why I said.
That's good. That's good to know, because a lot of the time, I think when it comes to sexual organs or anything related to sex, people usually try to go and address it only before they are going to start a sexual relationship or marriage. So I think definitely this is not like a 1 month facial pack that you can do where you want to get a glow before you get married. I think we have to understand that these things have to be addressed well before time, so that it gives time for all of us, for you to accept it, for your body to heal, and everything else. And I think that is very, very, very important. And we have another question which says, if someone has hypospadias repair, does it affect their tendency to masturbate or get an erection when they grow up into an adult?
Okay, that is also a good question, because I would say, yeah, there are physical causes after surgery where you can develop scars around the wound. Sometimes these scars can lead to painful sexual activity, and definitely they can masturbate. There is no question about it, and they will have an orgasm and they will produce sperms. But one thing on the sexual activity, yeah, definitely they might have, not always, might have pain if their scarring is more around the surgical aspect. Yeah.
Right. And would you say that they can, I don't know, if how sometimes when we'll talk about phimosis again another day.
Yeah, sure.
Yeah. So, but I'm just going to quickly say, how with phimosis, if we do tell people, if they keep, exercising or retracting their skin or massaging over it, it just makes it a little bit more easier. Could they do the same kind of a thing, when they're saying there's a bit of scarring that hurts? Could they probably try to work around that for masturbation, or?
No, anyway. That is not
Okay.
gonna help
Okay.
anyway.
Okay.
Either way, you have to do a scar revisions can be done.
We have to do again
So
a surgery for scar revision.
Scar revision.
Okay,
So
perfect.
scar
Okay,
revision
good
can
to
be
know.
done, but
That can be done. Okay, great.
nothing cannot say it is not like massaging. Nothing will help.
Nothing like that will. No conservative treatment. Again, we have to go back to the surgeon to see
Yeah,
what can be done, and it can
yeah.
be done, but we have to go back to the doctor.
Back to the
If you have a
doctor. Yeah.
problem, yes, please go back. Yeah, perfect. If you have a problem, please go back to the doctor so that they will be able to look at it and be able to help you rather than try to do, home remedies or, massages and stuff like that. Perfect. Okay, sounds good. I think I've asked all questions I have at the moment. Is there anything else that you feel I've missed or you would like to tell people about
Okay.
hypospadias?
Okay. See, now I'm not going too far, but I just
Mm-hmm.
want to say about the causative effects of why hypospadias occurs. One
Mm-hmm.
interesting
Yes.
fact what I learned when during my MCH postgraduate days and still teaching all around is environmental factors, genetic factors, and endocrine factors. These may be alien to people who are here. I don't know, but still I'll just rush through what are
Yes,
these.
yes, absolutely. It's so knowledge is power, Karan, and I think that's what I can't,
Yeah, and
emphasize enough. So
this what I'm gonna give it. I think people will tend to be more careful on what they are choosing for their future.
their
So
lives, yes.
definitely, what I'm gonna say is, so one is genetic. I'm not gonna talk about much genetic. Genetic is like parents who are hypospadiac.
Mm-hmm.
There are high chances of the offsprings like 8 to 9% they can develop hypospadias. Okay,
Mm-hmm.
one.
Mm-hmm.
Second is monozygotic twins. That is a twin where uh, they are called as identical twins. Okay, so that occurs when the fertilized ovum divides and produces two identical twins, and there is a single placenta. This placenta
Mm.
is necessary to give all the enrichment to the developing fetus. And
Mm.
since they share the same placenta, only one twin can have that enrichment that is called as the human coronary gonadotroph.
Mm-hmm.
Okay,
Mm-hmm.
so the other child might not have that much of enrichment,
Much enough.
and this can lead to hypospadias. Okay, which
Wow.
are this HCG is there for the penile development, so it
Right.
can lead to hypospadias. This is one genetics. So sure.
Perfect. Okay.
Second is endocrine. We have endocrine glands all over our body, and depending upon the need for sexual hormones, the endocrine system is activated and releases the endocrine factors which enter the circulation and tends to produce more uh, sexual hormones. That is the what I'm talking about is the testosterone. Okay, so this testosterone has to be converted into a more higher potential form called as the 5-hydroxytestosterone,
Mm-hmm.
dihydroxytestosterone. Okay,
Mm-hmm. Mm-hmm.
there you have a what to say, for converting there is an enzyme 5-alpha reductase.
Mm-hmm. Mm-hmm.
Okay, so
Mm-hmm.
if this any endocrine disruptor
Mm-hmm.
is present in the environment or throughout our life, this
Mm-hmm.
can lead to decrease in hydroxytestosterone production, which is again needed for this genital development.
Right.
Okay, so that is the second. Third is the most important thing, that is the
Wow.
environmental factors.
I'm learning so much.
Okay,
Wow.
environmental
Okay.
factors.
Mm-hmm.
So maternal age, increase in maternal age. Okay,
Mm-hmm.
one.
Mm-hmm.
Then increase in the primiparity, the age at which they conceive.
Oh, right. Okay. Elderly
Okay,
priming. Yes.
elderly
Okay.
priming. So
Yeah.
there are some factors uh, which can lead to hypospadias.
Predisposed to. Yeah.
I'll tell you why. I'll tell you why.
Yeah.
Okay. The second is uh, what to say. In India now, there are a lot of IVF centers.
Yes.
in vitro fertilization, that is fertility centers. And in
Yes.
India, people want you to get a child immediately after 1 year of marriage.
Yes.
And if you don't, you are considered as
Yeah.
infertile, and you are
Yes.
going to land
And
up in,
something is wrong.
yeah,
Yes.
something is wrong. People are stressed up with that, and they tend
Yes.
to run into their fertility centers.
Yes.
There
Yes.
is fivefold increased risk of hypospadias in children who are conceived through IVF or ICSI, that is
Wow.
intracytoplasmic
I should
sperm
write this down.
insemination.
Yes. Yeah.
Okay, that is
Yes.
why. So,
Okay.
as Dr. I'm sorry.
Sorry.
So, okay.
Yeah. Sorry.
Normally, females have progesterones in the body. They secrete progesterones, which is important for the egg to be fertilized and what to say, and inoculated into the uterus. Okay,
Yeah.
that is very much implantation. That is what we say as implantation into the uterus. Okay,
Yes.
but as doctors, we are FDA has been approved, and we give external progesterone
Yes.
for successful implantation of the fertilized embryo or ovum, fertilized ovum. Okay,
Oh, yeah.
this
Yeah.
progesterone can affect the 5-alpha reductase, which converts testosterone to 5-dihydroxytestosterone.
Oh, really?
So this can lead to hypospadias. Okay, this is one.
Wow. Okay.
So another point. And third is, this is the last and foremost where I can say a lot of things, industrial plastics or phthalates, which,
Oh, really?
yeah. So everywhere, and unfortunately, everywhere plastics are there in the world, and we are still trying to clean the plastics, and it's gonna live even in 100 million years of Earth. That is what studies have been saying. So that's why plastics are being abandoned, or it shouldn't be brought into the market. So industrial plastics, one. Second is vegetarian diet in pregnancy.
Vegetarian?
I'm not against vegetarians. I am not against any
I know. Correct.
but people tend to who are vegetarians or omnivorous, we tend to eat lot of fruits and vegetables during pregnancy.
Yes.
And here lot of pesticides are being used. Okay.
Okay. Okay.
These
Okay, like that, you mean.
these
Okay.
contains phytoestrogens, okay, which is again can affect the 5-alpha reductase and testosterone impairment. So that. Third, third is again industrial waste, which has been thrown out into the sea, where fishes eat a lot, and on top of the food chain, humans and animals are there. So again, we
Wow.
eat those things, again, the endocrine disruptor, okay? And in dairy products, where milk production has to be increased to make dairy products, again, hormones are being given to the
cow.
animals, cow.
Yes.
So these are all the problems which we have, which again disrupts the endocrine system. And recent analysis, unfortunately, we are in a sad scenario that human what to say, they have found plastics in human, microplastics in human embryos, and that is very
Oh God.
alarming.
Wow. Yes.
Yeah.
My God. It's scary. It's scary. When people talk about eco-friendly products and the damage that plastic is doing to the planet, most of us are taking on, and then there's some of them saying, oh, no big deal. But when we hear things like, what you're saying, it's amazing, and it just reemphasizes, that how much that we have to take this really seriously on board. And if things are actually causing, problems to our babies, our future, I think we have to take it really so seriously, really.
Yeah, because hypospadias is more common. It is rampant. It is increased over the years. It is 1 in 200 live births. So,
oh wow.
So it is.
Yes, that's a lot in India,
yeah.
I'm sure. Yes. Definitely. And I think, oh God, the amount of information you have given us is just absolutely fantastic. I'm sure I have to say this on behalf of the entire audience that is with us today. And this video will be heard, over and over. And I think it's absolutely fantastic. And I'd like to tell you all that Dr. Karbs has put his hand up to talk more interesting topics along with us. And we will be, talking about circumcision, undescended testes, phimosis, a few more really interesting things and important things that people tend to ignore or not care about, which can affect their sexual life and mental health in the future. And I think this is what I would like to really, really target. So I'm so glad that I've got this fantastic man that I'm going to torture a little bit more.
I'm really overwhelmed. Thanks for the opportunity because I've never spoken a social platform before. So I really thank you for this opportunity. And,
Pleasure.
And enlightening your audience and giving them a clear picture of what hypospadias is. Thank you.
Pleasure. I think I'm very lucky that that I am connected to a lot of you people who do such fantastic work now, and I think I can really.
You are doing a fantastic work because I think people need to know these psychosocial issues regarding this hypospadias, and I think still there are one thing if I want to say is there are no long-term studies, adult studies. People don't have not in India. I don't know about other states. But here we don't have a specialized clinic for them to undergo this post-surgical trauma
counseling and all of that.
And all. We don't have in India.
Yes.
So that is
and I think that is important. And I think also because we don't believe that mental health is a real thing. We always feel like give them 2 slaps and they will be okay. What mental health? So I think we are getting there. We're getting there slowly. And I think it's fantastic. I think we have to take this initiative and absolutely do this. So thank you so much for agreeing to do this. And we will definitely catch up again with another fantastic session.
Sure, Nili, sure. Thank you.
Thank you so much, Karbs. See you. Bye.
Bye.
Thank you, everyone. Thank you, everyone, for joining us today. And yes, I'll try to answer as much of question possible. And I know a few of you have asked this in a post form. I will ask Dr. Karbs to send me the last bit of factors that causes this, and I will put I'll summarize it and put a post up because I think people really found it extremely interesting, the factors that are responsible for hypospadias these days. So I think fantastic work. So thank you, everyone. Thank you for joining me today. And I'll see you all again. Thank you. Bye.
Thank you. Bye.
Thank you.